Yeah, students, good morning. Okay, today in this class, I'm going to discuss about organophosphorus compounds poisoning. Already we discussed barbiturates poisoning, like that. Okay, so today I'm going to discuss about organophosphorus compounds poisoning. Okay, so what is organophosphorus compounds? These are the chemicals generally used throughout the world, mainly in the agriculture. The mainly agriculture as a pesticides. Okay, sometimes this is also used as a nerve gas in the chemical war. Okay, so very limited therapeutic activity is observed from the organophosphorus compounds in the therapeutic point of view. Generally, we want to use organophosphorus compounds for therapeutic purpose. Okay, any therapeutic purpose generally used in agriculture field, but very few generally used for as a therapeutic agents like ecothiopate used in the treatment of glaucoma. Okay, used in the treatment of glaucoma. So generally organophosphorus compound spinning generally occurs because either maybe acute exposure and maybe chronic exposure. So what is meant by acute poisoning generally occur because of mm, uh, because of uh, administration. Okay, because of taking of organophosphorus compounds for suicidal purpose. Okay, because this organophosphorus compound generally available in the over the counter, so that majority of the patients will take that organophosphorus compounds. Okay, so they ingested that one. Okay, in such cases it leads to poisonous. Okay, sometimes it is exposed to organophosphorus compounds chronically. It is also one of the reason for development of chronic poisonings. Okay, so chronic poison generally may seen in farmers because they're exposed to pesticides while spraying the pesticides for their agriculture field. Okay, so this is the where poisoning occur. One is acute ingestion of the organophosphorus compounds for suicidal purpose. Second one is chronic exposure of the farmers to the organophosphorus compounds while spraying for their agriculture field. Okay, chronic exposure. Okay, next is based upon the toxicities, these organophosphorus compounds are classified into highly toxic, intermediate toxic, and low toxic. Highly toxic drugs are parathion and pyrophosphates. Generally, they are used as a agriculture insecticide that generally spray in the agriculture field. Next is intermediately toxic organophosphate phosphates. Example, so chlorpyrifos, trichlorophane. These agents majorly used is animal insecticides. Animal insecticides like killing of the rats. Okay, like that. Okay, animal insecticides. Okay, low toxicity. Example, malathion, dichlorowas, diazinon. These generally use household application and as a field spray. So whole household means in insecticides generally. Okay, you can use. Okay, these are the three types of toxicity. Based upon the toxicity you can classify the organophosphorus compounds. Okay, so next is this is the where you got exposure to organophosphorus compound. Home exposure because of accidental ingestion, maybe while spraying garden. Okay, garden plants, or maybe while spraying insect control, maybe food supply, water supply. Okay, even food supply, water contamination, food contamination, water exposure to organophosphorus compounds, they also cause toxicity. Occupational exposure generally seen in farmers, those who are closely exposed to the always with organophosphorus compounds. Okay, so next is other exposures like dietary exposure through pesticides rich crops. Next, leaching from soils to groundwater. Okay, So airborne drift from commercial applications. These are all different type of exposure to organophosphorus compound. You can mention or very few. Okay, right in examination. Now coming to so how these organophosphorus compounds causes toxicity. There is some mechanism is there, like suppose how barbiturates cause poisoning because of overactivation of the overactivation of the GABA receptors. Okay, so excessive and chronic stimulation of opioid receptors are not opioid GABA receptors by the barbiturates will lead to excessive pharmacological actions, excessive center depression list related toxic effects. The same thing you can observe with organophosphorus compounds. Okay, because of their action only, mechanism of action, it results into so many manifestation. So, what is the main mechanism of action of organophosphorus compounds? Organophosphorus compounds are they are they are irreversible inhibitors of acetylcholine esterase. Acetylcholine esterases. So these are the inactivators of acetylcholine esterases. Okay. So acetylcholine is an enzyme. It is distributed throughout the nervous system, including central nervous system and autonomic nervous system. Acetylcholine is a neurotransmitter. It is distributed in central nervous system and peripheral nervous system, especially in the parasympathetic nervous system and somatic nervous system. Parasympathetic nervous system and somatic nervous system, where it is used as a neurotransmitter. Okay, so immediately after releasing from the presynaptic neuron, before it is binding, after binding with receptors, specific receptors like muscarinic nicotinic receptor, the remaining acetylcholine is rapidly undergo inactivation or hydrolysis by the interacting with acetylcholine esterase enzyme. Okay, so this acetylcholine esterase has two sides. One is anionic site, one is esteratic site. Okay, so these organophosphorus compounds, they especially bond covalent bond with esteratic site. Okay, so it will organophosphorus compound phosphorylate the esteratic site, by which there is a formation of irreversible bond. Okay, so once they bind with they bind with acetylcholine esterases, it permanently inactivated, so that acetylcholine will accumulate it. Acetylcholine is accumulated in the central nervous system and autonomic nervous system. So there is a overstimulation of the cholinergic receptors, muscarinic receptor and nicotinic receptor. So it causes toxic manifestations. Okay, toxic manifestations. Are you clear? So how organophosphorus compounds they cause toxicity? Organophosphorus compounds, they are the inactivators of acetylcholinesterase enzyme. With this, uh, there is a with this there is a deficiency, not deficiency. There is a failure of acetylcholines to inactivate. So over accumulation of acetylcholine at cholinergic receptors such as muscarinic and nicotinic receptors. Okay, it causes toxic effects. Okay, next, what are the major um, clinical features of okay, now I am talking about mechanism of action of the organophosphorus compounds. Later on, what are the clinical manifestations of organophosphorus compounds? So organophosphorus compounds toxic effects are, they're broadly divided into three categories. One is muscarinic receptor activated toxic effects, and nicotine receptor activated effect, and central receptors. Okay, CNS related effects. Okay, so first is generally these manifestations occur within 24 hours and those who recover usually do so within 10 days. Okay, these fatalities occur within 24 hours, and also those who recover usually do so within 10 days. Okay, uh, gen, uh, so symptoms, this table will give you symptoms. Okay, symptoms. Okay, muscarinic symptoms, nicotinic symptoms, and central receptors. Okay, activated effects. Okay, so first muscarinic. Okay, so generally muscarinic receptors generally expressed in three sites. One is heart, heart. Second one is smooth muscles. Third one is glands. Okay, heart. Okay, smooth muscles, especially GIT smooth muscles, bronchial smooth muscles of eye. Okay, next smooth muscles of urinary bladder. Okay, glands. Okay, glands is nothing but salivary glands, sweat glands, lacrimal glands, bronchial nasobronchial glands. So these are the so many glands. So the manifestations restricted to these parts only. Okay, so cardiovascular. So generally excessive acetylcholine cause bradycardia, hypotension. So whatever the whatever the pharmacological actions you may see with acetylcholine, the same pharmacological actions will be appear in more severe form. That is only manifestations you observed in the organophosphorus compost poisoning. Okay, so bradycardia, these are the manifestations. Okay, bradycardia, hypotension, so respiratory, rhinorrhea, excessive runny nose, okay, bronchospasm, cough, gastrointestinal nausea, vomiting, excessive salivation, severe abdominal cramps, okay, uncontrolled defecation, that is diarrhea, and fecal incontinence. Okay, fecal incontinence, fecal incontinence is nothing but without your notice the fecal matter is sending out. Okay, so next is genitourinary tract. So again same urinary incontinence. Incontinence, it is a because of the urinary bladder instability. Okay, urinary bladder contraction effect, it causes urinary incontinence. So eyes, okay, blurred vision, increased lacrimation, and meiosis, decrease in pupil size. Glands, excessive salivation, excessive sweating. Okay, uh, excessive bronchial secretion you may see in uh, poisonous cases. Nicotinic. Okay, so nicotinic receptors generally not only present in the skeletal muscles. So okay, right. So it is also present in the ganglia part. So in the ganglia, both in ganglia of parasympathetic and sympathetic, stimulation of nicotinic receptors in the ganglia of parasympathetic nervous system, there is a over activation of the sympathetic nervous system also possible. With this, there is a suffering from tachycardia and hypertension also. Okay, musculoskeletal nicoreceptor mainly expressed on skeletal muscle. So excessive skeletal muscle contractions. Okay, it leads to fasciculations. Okay, fasciculation, fasciculations means formation of contractions in the facial muscles. Okay, so next skeletal muscle cramps. Okay, pain. Okay, next weakness, excessive contraction leads to skeletal muscle weakness. So last one, excessive contraction followed by paralysis. So these are the musculoskeletal problems. Next, central nervous system. Okay, initially there is a anxiety, restlessness, convulsions, insomnia, tremors, last in coma. Okay, initially stimulated effect followed by coma. So loss of all reflexes, respiratory depression, and circulatory collapse. Okay, so this is about the clinical manifestations of organophosphorus compounds. Okay, this is about clinical manifestation. These clinical manifestation mainly due to because of the activation of cholinergic and nicotinic receptors. Okay, so this the WHO classify the severity of the organophosphorus compounds like as like this: mild, moderate, and severe. When you call as a mild, so when you see the serum, okay, RBC cholinesterase level. Okay, cholinesterase. So cholinesterase, free cholinesterase level is the indication of whether it is going to be inhibited or maybe it is free. Okay, so you can check the serum RBC cholinesterase enzyme. If the level is 2 to 8 units per liter, this is nothing but mild. If it is only 0.8 to 2 microliters per liter, it is moderate. If less than 0.2 microliters per liter, okay, cholinesterase, it is called as severe. Okay, how mild? Mild, one of the way is based upon the serum concentration of enzyme. One of the way is symptoms. Okay, if the patient is walks, talks, okay, but simply the patient suffering from abdominal pain, nausea, vomiting, headache, salivation, and sweat. So when you call moderate, talk with soft voice, cannot walk, okay, fasciculations present, meiosis, restlessness, anxiety. Severe is nothing but convulsions, coma, profuse bronchial secretions, and okay, convulsions. These are the based upon the symptoms you can classify the severity of the poisoning, such as mild, moderate, and severe. Okay, see, this is about the clinical manifestations of the uh, this thing, okay, organophosphorus compounds. Next, neurological manifestations. Okay, so neurological manifestations are also three different type of paralysis are recognized based on largely on the time of occurrence and their different pathology. Okay, so type 1 paralysis, acute type 2 paralysis, and type 3 paralysis. Okay, neurological manifestation, they are classified into three types: type 1, type 2, type 3. Okay, so what is meant by type 2 paralysis? How this type 1 paralysis generally observed? Okay, this is the large number of both muscle and receptor occupied by the acetylcholine, leading to persistent depolarization at neuromuscular junctions. Okay, majority of these paralysis, okay, skeletal muscle paralysis, neurological manifestation mainly occurred because of the this type 1 paralysis mainly occur because of the excessive or persistent or chronic depolarization of the neuromuscular junctions. Okay, clinical manifestations simply include muscle fasciculations and muscle contractions, cramps, stitching, and weakness. Okay, next is especially this type 2. Okay, type 2 paralysis generally appeared as like this. Okay, so there is a progress muscle weakness. Okay, weakness in the ocular muscles, neck muscle, so that the patient cannot raise the head, or he cannot hold the head. So there is a proximal limbs also. Okay, paralysis of proximal limbs, and the very dangerous effect is relaxation of the intercostal muscles, respiratory muscles. It leads to respiratory failure. Okay, so next is type 3. Okay, type 3 paralysis organophosphorus induced delayed neuropathy. Okay, he is nothing but there is a sensory or motor neuropathy generally seen when you when observed with a large dose of organophosphorus compounds. Neuropathy, okay, persistent as a weakness and ataxia following latent period of 2 to 4 weeks. So how type 3 paralysis will be manifestations? Okay, type 3 paralysis organophosphorus induced neuropathy, it is manifestations as a muscle weakness, okay, and ataxia. Okay, even after the recovery of the patient, it may observe even after 2 to 4 weeks of, okay, 4 weeks. Okay, so this initial stimulation cause excitatory fasciculation, progress to inhibitory paralysis. Okay, mm, this mainly weakness, especially distal weakness of the hands and feet, generally missing in peripheral neuropathy. Okay, and also paresthesias. Okay. So this is about the so manifestations of the organophosphorus compounds. Okay, nicotinic actions, muscarinic actions, center actions, and neuropathy. Okay, neuropathy related problems. Okay, next is so diagnosis. Generally, diagnose the organophosphorus compound based upon the sign and symptoms only. One more is a garlic like smell. Okay, one more thing is estimation of cholinesterase enzyme functions. Okay, so clinical severity graded based upon the pseudocholinesterase enzyme. Mild, okay, toxicity in this case only 25 to 50% anxiety observed, moderate 10 to 20, severe means less than 10%. Okay, so based on all these things you can confirm the organophosphorus compound based upon the clinical manifestations, based upon the added garlic like smell is one of the major uh, sign you can observe. Next is based upon the cholinesterase enzyme activity. Okay, so the only useful biochemical tool for confirming exposure to organophosphorus compound is clinical severity graded on the basis of pseudocholinesterase level. Okay, so this is about the diagnosis of organophosphorus compounds. Suppose still if you have doubt, then you have to analyze the aspirated fluids, whatever the vomiters, or you are going to be collect and identify the okay chemical analysis in the okay samples. So still if you doubt, you can go for administration of atropine okay intravenously. If does not produce any marked anticholinergic, generally atropine produce anticholinergic effects. 1 mg atropine given intravenously, even after atropine generally general if suppose if the patient is not with organophosphorus generally what happened, there is a development of anticholinergic manifestations like dryness of mouth, dryness of skin, blurred vision, okay, mydriasis, increase in heart rate, so on. Okay, so even after administration of atropine, if the manifestation of anticholinergic is not observed in the patient, so you can confirm that the patient mainly because of the okay so organophosphorus compounds. Okay, so this is about okay until now